Hello, my name is Laura Stepien, and this is a video lecture about medical nursing procedures. So you can read more about these procedures in Chapter 6 of the Elsevier Veterinary Assisting textbook. So in this video lecture, we're going to talk about a few different medical nursing procedures. We're going to talk about physical exams. We're going to talk about nail trims, anal gland expression, bathing, and ear cleaning. We're going to leave fluid therapy and wound management for separate lectures. So first off, physical exam. Every pet that comes into the vet hospital is going to have a physical exam. Typically, it's going to be the veterinarian performing that physical exam. Usually, if it's an appointment, the client will be there and the doctor will do the exam in an exam room with the client. There are times though we might have drop-off pets and then maybe an assistant or a vet tech will be restraining the animal for the doctor to perform the physical exam. So the doctor is going to do a physical exam by using their visual skills. So they're just observing the animal. They're also going to use their listening skills by using auscultation. If we remember, that means we're going to listen to the heart, listen to the lungs with a stethoscope. And as well, they're going to use palpation, which is like massaging and feeling the animal in order to examine them. So first up, visual observation. The doctor is going to look at the animal. So they're going to look at the eyes, look at the ears, inside the mouth. They're going to check all the skin, everything we can see on the animal, the doctor will observe. So in order to examine the eyes, the inside of the eyes, the doctor will use an ophthalmoscope. And then to examine the inside of the ears, they'll use an otoscope. So I do have pictures for you here of an ophthalmoscope and an otoscope. You can see that the otoscope has these little cones and they go onto the end of the otoscope to direct the light down into the ear canal and to be able to kind of open it up and see everything. Those cones need to be a separate cone for each ear, or it needs to be cleaned and disinfected in between each ear. That's the reason for that is because we don't want to spread contamination between one ear and another. Then the ophthalmoscope here, you'll see it has different light settings so that the doctor can see inside the eye. So the next thing the doctor is going to do is auscultation. So auscultation is listening, and the things that the doctor is going to listen to is usually the heart and the lungs. So they're going to use a stethoscope to do that. They're looking to hear if there's any abnormal heart or lung sounds, or if everything in there sounds nice and normal. And then finally, they'll use palpation. So that's touching and feeling. So basically, we give the animal a good pet all over. We're checking to see if we can feel any lumps. We're checking to see if there's any pain reaction from the animal as we're touching them. As well, the doctor will do abdominal palpation. So it's like a kind of a tummy massage for the pet. They can feel the internal organs. They can feel if like the animal's really constipated, if they're pregnant, if they have a mass. Sometimes we can feel those things in the abdomen. And then as well, they'll assess all the joints by moving them while feeling the joint. So we can assess a lot of joint problems by palpating the joints. So if you are getting supplies ready for a basic physical exam, you're going to make sure that there's a stethoscope, an ophthalmoscope, and an otoscope with the appropriate sized cones. If the doctor needs to do any further examining, like if there's a specific eye condition or something like that, you might need to gather additional supplies as well. But for just your basic physical exam, just those 3 scopes is all we need. So next, let's talk about nail trims. So you may or may not be surprised to learn that vet clinics do tons of nail trims. So lots of clients just are either unable or unwilling to trim their pet's nails. Lots of people are scared to do it because they're afraid they're going to make their pet bleed. So often they just want the professionals to take care of it, and we are happy to oblige. Typically, nail trim appointments are going to be scheduled with the vet techs. Or it might just be part of what's happening when we have the pet in for an exam. So it might be part of their treatment plan, especially if they have any kind of issues with their nails, then certainly nail trim is going to be part of the treatment plan. So trimming of nails should be done about every 6 to 8 weeks, but it's very individual. Some pets need it sooner, some pets can go much longer. We don't want to let the nails get really long because it can cause problems for the pet. So really long nails can alter their gait. The gait is the way that they walk. So typically, if you remember back to our anatomy and physiology, we remember that dogs and cats walk on their toes. So it's just their phalanges that is actually contacting the ground, as opposed to us, where we're like, if dogs and cats walk the same way we do, they would have their full foot flat on the ground all the way to the hock, but they just walk on their tippy toes. So if their nails are exceptionally long, they need to kind of compensate for that and start kind of flattening the way they walk. So it alters their gait because those nails are pushing up the toes and making it uncomfortable. That, if it continues on, can lead to lameness. So either the animal not using a foot or not using any of their feet. Also, long nails are more likely to end up splitting or having some kind of trauma. They could be avulsed, which means pulled or torn right out from the root. So you just have like kind of a bloody root left there. And also long nails, especially with cats, because they get really sharp, can grow all the way around and then back into the toe pad and grow into the skin. I've seen some where it's a good, like probably centimeter piercing the skin. That's really long and really uncomfortable for that animal. Think about having to walk on your toes with like an ingrown toenail. That would really hurt you, right? So it's the same kind of thing with cats and dogs. Well, cats more so with the ingrown nails. Dogs, if they do get ingrown nails, it usually tends to be their dew claw that ingrows. The other ones tend not to actually grow back into the nail, usually. So when we're doing nail trims, we have 3 different nail trimmer styles. So the first one, they look kind of like a pliers style. That's usually the one that I recommend the most to clients with dogs. If they have a large dog, that's the style of clipper that I certainly prefer. They're very easy to use because it's kind of just like pliers. This middle one, the guillotine style clippers, oh geez, these are tricky to use. You need to hold them correctly. And the way I have them pictured here is the correct way. So this long flat part should be the part that's held up in your hands. The reason for that is when you squeeze this, if you have it this way, this bottom part doesn't move at all. If you're holding it with this, the bottom part here on top, what happens when you squeeze it is that it advances it forwards and then trims. So you get it all lined up for where you want to go, you go to clip it and it moves further back and you end up pricking the animal. So these have to be held correctly in order to be useful. Lots of clients really struggle with these ones. You have to get the nail through this little circle here. I don't really recommend them unless you already know them and love them. I don't even recommend them. And then the last style here is like a scissors style. And those ones typically are used for cats. I also love the scissor style for small dogs as well. I just feel like it gives me a little bit more control. So we have those 3 different styles of trimmers. So you might be asking, well, how do we even cut nails? So first thing to know about nails is that dog and cat nails are set up a little bit differently than ours. We have a nail bed. Our nails extend past the nail bed. Their nail bed is kind of enclosed inside the nail, and the nail is like tubular. So the inside of the nail is called the quick, and that quick area contains blood vessels and nerves. So if you cut the quick, it's going to bleed, it's going to hurt. So ideally, we do not want to cut the quick. So what I typically do is just take off a couple millimeters at a time, and just until I start to see the beginning of the quick. Lots of people will say, but how do you see the quick? If I have a dog with white nails, I can see the pink on the side. But if I have a dog with black nails, how do I see the quick? So in order to do that, when we're trimming the nail, we look at the nail head on. And what we'll see there is when we're trimming and we're not near the quick, it'll just look white with like a black outline for the outside of the nail. As we start to get close to the quick, we'll start to see the beginning of a black dot. That dot is the start of the quick. Once we see that, we can stop. Okay, so if you're a client, that's what I tell you. If you see that little start of the quick, stop. What I do personally is I see the start of that quick and I keep cutting because I'm a vet tech and I've got a lot of practice and I know how to get those nails really nice and short. So what I do is I take them right down to the quick and I get them really nice and low. So, you know, people get their money's worth when they bring in their pet for a nail trim with a tech. But at home, I always tell clients, as soon as you see that little dot, just stop. And then they typically won't be cutting into the quick. So if we do cut into the quick though, we do have some options. So in the vet hospital, we have the choice of using silver nitrate applicators. This is not a product that's available for clients to purchase. I also probably wouldn't sell these to a client. So silver nitrate applicators are these little sticks that you see here. They are light sensitive. So they come inside like a black container, usually like a black kind of plastic bag that's light proof. Keep them in there. They are light sensitive and they will degrade and not work if they have been exposed to light. These silver nitrate applicators we use to cauterize bleeding nails. So we just take the little white end here and just touch it to the nail and it's and it seals off the blood vessels and stops them from bleeding. Beware though, silver nitrate does stain your skin, it does stain fur, and it can stain certain kinds of tabletops. So do be aware of that. If you don't have stainless steel tables, you may want to put a towel down for nail trim so that you don't get any silver nitrate onto the table. When it does stain your skin or the fur, it's just a matter of time until it cleans off. Your skin usually will kind of fade within like a week or two. The other option we have is this quick stop powder, which is a styptic powder. So this can be purchased in pet stores. So this is an option for clients as well. If clients don't want to make a specific purchase of something like styptic powder, they can also use flour or cornstarch. You just take some of that powder, pack it on the bleeding nail and hold some pressure there and it will stop bleeding. And then I have a third tool pictured here, and that's a Dremel or a grinder tool. So this is popular in some clinics to use after having trimmed the nails with the nail trimmers, to use these to just get them a little bit shorter and that little bit smoother. You can also get the same benefits from just using a manual nail file. I prefer using a metal one than like say an emery board, but a metal nail file can be really great to smooth any rough edges as well. So if you don't have a grinder or a Dremel, a nail file is going to be effective as well for that. So if you have a nail trim coming in and the vet tech or the doctor asks you to set up for it, you're going to need to know the size of the animal so that you can choose, do you want to use like the little scissor ones, or do you want to use like the bigger kind of plier style? Or I don't know, if you're a guillotine fan, maybe you have that one on hand. And I always like to grab the silver nitrate sticks because you just don't know when you might accidentally quick an animal. And having those silver nitrate sticks on hand is really helpful, as opposed to having to be like, oh my goodness, can someone grab me the silver nitrate sticks? This animal's bleeding all over the place. So it's better to have those on hand and available than need to have to go get them when you need them. Okay, next, let's talk anal gland expression. So first of all, sorry for this picture. It's always a pleasure to have to look at an animal's butt, hey? So anal glands are something that is part of the normal anatomy of cats and dogs, not humans, thank goodness. So dogs and cats have these anal glands and they are scent glands. And the scent, it's not a pleasant one, it's quite stinky. So these anal glands are located just inside the anus. You can see these red circles here are showing us where the anal glands are. They're located, if you picture the anus like a clock, they're located at about the 4 o'clock and the 8 o'clock spot. And usually these anal glands are emptied during a bowel movement. So as long as the animal is having normal poops, the anal glands should be emptied at the same time. So usually anal gland secretions are deposited on the feces and then they go along their way. Sometimes though, pet glands don't empty naturally and will require that manual expression. There's a lot of reasons for this. We'll certainly cover them in our common conditions course. But just to give you a little preview, there can be issues with anatomy. There can be issues with the secretions itself. So there's quite a few things that can contribute to them not expressing it normally. So this says internal expression. Internal expression is only for veterinarians and vet techs. Those are the only people that can practice this procedure. Groomers should not be doing internal expression. It's only for vet techs and doctors. So to do this expression, what we do is we put on a glove, because you should never put an ungloved hand into a bum. So glove up your hand and also lube up your finger that you're going to be inserting into the anus. Again, it's just rude to not use lube. That's going to be uncomfortable for the animal otherwise. And then we just feel for those anal sacs. We see how full they are, and then we squeeze them until they empty. So it's kind of like a massaging motion I use to like squeeze out. It's like, you know, with toothpaste when you're pushing up from the top, it's like that kind of motion to get the expression out. So, or sorry, the secretions out. So we're going to take note of the size of the anal sac, how easy it was to empty them, and we're going to describe the material as well. Typically, normal anal sac material is kind of a oily, greasy kind of liquid. It smells foul. They all smell foul. Sometimes there's a little kind of flecks, like dark flecks in it as well. So that would be the normal appearance of anal sac material. We're going to record that description and the other information in the pet's medical file so that that is documented and we can compare with previous expressions to see how the animal is doing. So you might be asking, internal expression, is there an external expression? And yes, there is. So groomers could technically do external expression, and I think this is what a lot of them do, is try to express the anal glands this way. The problem with doing this is that it doesn't do a good job. So external expression is basically just kind of pinching the bum and hoping that those ducts empty. But the reality is they don't usually empty fully. The ducts, when you're squeezing them, often occlude, which means that nothing is coming out. And guess what? That hurts. It hurts to try to squeeze things that aren't able to leave. So external expression is not recommended, and we don't do external expression in the animal hospital. So a couple more photos for you here. You might be thinking, well, how do we know that an animal even needs its anal glands expressed? So that's a great question. One of the classic signs is what we see this first dog here doing, and that's called scooting. When they're dragging their butts on the ground, often, I mean, it could just be a bum itch, but if they're doing that in conjunction with other signs, it certainly is indicating that they could have an anal gland issue. Other signs we might see is paying a lot of attention to that area. Like if they're licking at it or chewing at it, that could indicate it's painful or irritating to them. You might see redness or inflammation on and around the anus area. They could be holding their tail abnormally, like kind of up and like curved away from their bums. And of course, they might be really stinky because anal glands stink. This middle picture here is showing you an example of really thickened anal gland material. So like I said, it's usually oily and liquidy. This is like a toothpaste consistency. When they're like this, it's really difficult for the animal to express that normally. So we're going to have to express these manually. And then lastly, if someone has an animal that requires anal gland expression and they don't bring them in for that, the animal is left untreated, that anal gland will eventually fill up to the point that it abscesses and ruptures. So it becomes infected. That's an abscess. It becomes infected, and then it gets large enough that it will rupture right through the skin. So you can see here's the anus here, and then there's the rupture right beside it. When that happens, then we have to deal with a whole wound management issue, plus the infection, plus the anal gland issue. So it's certainly recommended to have anal glands expressed regularly if that is needed for the animal. So again, if you are in the clinic and you're working as an assistant and someone says, we have an anal gland expression coming in, can you get set up for this? You are going to grab the following materials. You're going to make sure you have some exam gloves. It pays to know the size that the person doing the anal gland expression wears. So there's like small, medium, large, maybe even extra large for gloves. Find out what the person you're working with that day wears so that you can make sure you're all set up for that. We need lube. We need some tissues so that we can collect the anal gland material in the tissues. We need some cleaner spray so we can clean the bum after. And I personally like to use a little bit of odor eliminator spray that's animal safe. So there's one specifically called AOE, Animal Odor Eliminator. I like to give a little squirt of that on the bum as well, because it is enzymatic and helps to break down some of those odors. I don't like to send animals home with their owners if they're really stinky. So it's good to have that odor eliminator spray for them. Okay, so bathing. Bathing is something else that might need to happen in the hospital as well. There's lots of different reasons why. Sometimes, they pee their pants or poop their pants and they got mess all over them. So in that case, they might need a full bath. If they've just like stepped in some poop, but the rest of them is clean, I'm just going to wash the paw. I'm not going to give them a whole bath if I can help it. But sometimes we do need to do a whole bath, especially if they require medicated baths. So medicated baths would be with like a shampoo, maybe like an antifungal shampoo or an antibacterial shampoo or an anti-seborrhea shampoo. So those are all different possibilities that they might need a medicated bath with. So first step always for any of these procedures is to like gather your supplies. So I made a list here for you for bathing. You want some kind of grip in the tub or in the sink, depending on the size of animal you're bathing. That can look like one of those sticky rubber tub mats, or it could look like even like a towel in the tub. Something so they're not just scrambling on that, whatever it is, porcelain or stainless steel, whatever your tub is. You need to get some cottons, like cotton balls. We need eye lube, we need eye wash. We need shampoo, either the medicated prescription shampoo for that pet, or sometimes we would just use like a plain shampoo if they're just like poopy or something. We need a face cloth to wipe the face and clean it. We need towels to dry them off, and we need a blow dryer. We do not want to leave animals in their kennels if they are wet. We want them nice and dry before we return them to the kennel. So our procedure for bathing, we're going to gather all our supplies, put the grip in the tub, right? We kind of went over that already. So what are we going to use the cotton for? We're going to put that in their ears. We do not want water getting inside the animal's ear. We want to keep that area nice and dry. We're also going to put lube in the eyes because that will protect the eyes from getting shampoo in it and making them sting. So then we're going to start bathing them then. Now we're going to turn on the water. We're going to check that water temp. We want it warm, not hot, and we don't want it cold. So we want it nice and comfortable for the animal. My tip for you is while you're holding whatever it is that you're washing with, like, you have one of like these things, these handheld showers, keep your finger in the water at all times so that you can feel the temperature the whole time. And you'll know, sometimes like someone flushes a toilet and it changes the water temp or something, then you can get that right off the animal as soon as possible, as opposed to not knowing about it and possibly like burning them. So once you've got a comfortable temperature for the pet, you're going to wet them down head to toe. Don't just pour water all over their face. What I usually do is just make my hand wet and then pet their face area to make the face wet. Then you're going to, I usually shut the water off, get some shampoo and lather it up, and then massage that into the animal's fur. If it is a medicated bath, we need to make sure that we know how long that shampoo needs to sit for before being rinsed. Sometimes it's like 10 minutes. So we need to let them sit with that shampoo for 10 minutes. In that time, it's a great time to make cutesy wootsy noises at them and talk to them and help them to feel comfortable. Give them some TLC. Then it's time to rinse the pet. Again, check your water temperature first and then rinse them off until there's no more soap. Make sure you're getting all areas of the pet. Armpits and groin are places where soap likes to hide. Once we've got the animal fully rinsed, I didn't make a note, but like the face cloth I'll use to wipe the face. Again, I'm not gonna like wash the face directly unless it's really soiled or something. I just kind of use the cloth to wipe it down. And then we're going to dry with the towel, get them as dry as possible, and then blow dry them until they're nice and dry. The exception to what I said about leaving them in a kennel with a blow dryer would be if you have kennel blowers, then it would be okay for them to be in the kennel with the blower on them. Once we have the animal nice and dry, we can remove the cotton from the ears. Do not forget this step. And we'll rinse the lube out of the eye by using the eye wash. So cautions for bathing. It is important to make sure that we are monitoring our patients that are hospitalized regularly and cleaning them as needed. So hospitalized patients, any patient can develop skin irritations from urine or feces scalding. So both urine and feces causes skin irritation if it's left on the skin. Not to mention it's just poor care to leave an animal sitting in its filth, right? So if an animal has soiled itself, it needs to be cleaned immediately. If though we have animals that have any kind of difficulty breathing, we absolutely are not going to give them a full bath. We're just going to change their bedding and spot clean them. Ideally, I prefer to just spot clean for mess unless the animal's like covered in it. And I have had animals that are covered in it and then we need to wash them. But if they've just like stepped in it and they have a little bit kind of mushed into their foot, we can wash just the foot and spot clean it that way. Okay, so ear cleaning. Ear cleaning is something we would do separate from bathing. We don't want water in the ear necessarily because water makes the ear moist, the ear is nice and warm, and the ear is dark. That's the perfect growth location for bacteria and yeast. So ideally, we do not want to leave the ears wet because that's how we can end up with infection in there. So one thing that's good to know about dogs and cats is they have an L-shaped ear canal. So it looks like this. That means that the tympanic membrane or the eardrum is way down here at the bottom of the horizontal canal. So that means you can put your whole hand into the ear and you're not going to be touching that tympanic membrane. That's different than humans who only have the horizontal canal. If you stick something in your ear, you're going to hit your tympanic membrane. So please don't try it out. But know that it's different with dogs and cats. You can put your whole finger into the ear and you will not touch the eardrum. So otitis externa, that's an ear infection. Very, very, very common. I probably do at least like, I don't know, 5 to 10 ear cleanings a day. It's very, very common. It can be caused by bacterial infections, yeast infections, and ear mites, or a combination of all three. And it causes a lot of issues for the animal in terms of like pain in the ear, itchy in the ear. They might start head shaking. It can have smelly discharge in the ear, etc. So when we do have an animal that's come in with an ear infection, first things first, before we do any kind of ear cleaning, the doctor needs to examine the ear. They're going to use an otoscope. And again, they're going to use a separate tip for each ear so that they're not cross-contaminating. It is possible to have a unilateral ear infection, which is uni meaning one and lateral meaning side, one side ear infection. The opposite would be bilateral, which is both sides. So the doctor's going to look for a couple things when they're doing that ear exam. They're going to look for redness, swelling, and discharge inside the ear. They're also going to check and see if there's a lot of hair that might be trapping bacteria and stuff in the ear. And they're also going to check the tympanic membrane integrity. That eardrum has to be intact for us to do an ear clean with ear cleaner. If we were to clean an ear with ear cleaner that has, in an ear that has a ruptured eardrum, we could cause a lot of further damage. So we could cause permanent hearing loss. We could damage their vestibular function, which if you remember is like that sense of equilibrium and balance. We could also cause facial nerve paralysis. So not to really hammer this home, but let's really stress we need to do an exam before we do ear cleaning or ear treatment because we absolutely need to make sure that eardrum is intact. So if the doctor does discover that there is a tympanic membrane rupture, but they really want the ear cleaned, typically they'll ask for a really gentle ear flush with either saline or water. I'll typically use saline because it's sterile. We want to try to flush stuff out without putting any cleaner or doing any wiping or anything in the ear. So if the doctor discovers there's quite a lot of hair in the ear, they're going to request us to do some hair plucking. I showed you an example here. You can't even see into the ear because there's so much hair there. This looks like maybe I don't know, maybe like a golden doodle or something. I'm not sure, but it has quite a lot of hair in that ear. When there is a lot of hair in the ear canal, it traps heat and moisture, which is, again, the bacteria's favorite thing for growing. And it traps debris, which means that it's not getting out of the ear. All those things contribute to an increased risk for infection. If we are going to pluck excessive hair, we're going to do it with either our fingers, if possible, or hemostats. I prefer a curved hemostat I feel like it is a little bit easier to get the hair and pull it out without pinching ear skin. We need to be really careful that we are not pulling on the skin, just the hair when we're plucking ear hair. This will be something that the vet tech does, mostly for these kind of procedures. The assistant is going to be restraining the animal and gathering supplies to prepare for the procedure, but they won't be performing the procedures themselves. It is possible that the ear is really badly inflamed and infected. If that is the case, we might not want a hair pluck now because that could cause the inflammation and everything to get worse. So we might need to wait until there's been some healing time and the ear isn't as painful before we pull that hair out. And then what is the procedure for ear cleaning? So this is, like I said, it's something that we're going to do. I'm just trying to get this out of the way so we can see all the words. There we go. It's something that the tech is typically going to do, but it's really important for you guys to know the procedure here as well, because often vet assistants are asked to provide client education to the client on how to do ear cleaning at home. So this procedure, while you yourself won't perform it in clinic, you might be teaching clients how to do it. So first things first, as with all our procedures, we're going to gather our supplies. So what does that look like? Whoops. The supplies to gather for an ear cleaning, we want a towel. I personally like to wrap it around the patient so that they're not getting soaked while I'm cleaning them. And then I use that towel after to dry their head. We need some ear cleaning solution, and we need cotton or gauze squares. Oh, and I personally like to wear gloves when I'm cleaning ears. I just think they stink, and I think that stink stays on my fingers, which I don't like. So I wear gloves when I'm cleaning ears. So once we've gathered all our supplies, we're going to apply that ear cleaner solution to the ear canal. So I basically pour it in until I can see it that it's filled it up all the way. Then you're going to massage the base of the ear. I have a little toy puppy here. We got Doug from Up. So the base of the ear, right down here where the ear attaches to the head. And I just kind of do this motion. It's like a massage motion. And you hear it go, whoosh, 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 whoosh. You hear it swashing around in there. That's a good thing. That means that all that ear cleaner is swishing around and washing out all that debris. Once we've done that, this infographic says let your dog shake their head. And yes, you could let them do that. I recommend letting them do that with a towel over their head so they don't splatter ear debris all over your home or all over the clinic. I personally prefer them not to shake their heads just because it makes such a mess. I don't like when they shake their head and I get, ear cleaner solution and gunk all sprayed on my face. That's just gross to me. So I personally do not let them shake their head. So once we've massaged and it's all spread around, we need to clean that out now. So we're just going to use cotton or gauze squares. We can, I just kind of wrap it over my finger. I put my finger into the ear canal and I just wipe my finger around and then pull that cotton out, dispose of it, and repeat until I'm getting that cotton coming up clean. If it starts getting too dry, you can add a little bit more ear cleaner in there, swash it around a bit, and then continue to clean it out. We want to repeat those steps until the cotton is coming up clean. And then once we've done that, if it's for one ear or both ears, we do however many ears need doing, and then we can dry off the animal. I don't want to send a client home with their pet soaking wet and covered in ear debris. I want to clean that all up, dry it off, give them a little brushing, make them look nice before I send them home. And then this is the slide that just had the supplies for ear cleaning. And then that's it. So for a kind of basic medical kind of grooming procedures, that's everything that we're going to talk about here. We will have 2 additional lectures. One will be about fluid therapy, another very common medical procedure, and we'll also talk about how we manage wounds, but those will be 2 separate lectures. If you do have any questions about anything we covered in this lecture, do please reach out to your instructor, and thank you so much for watching. Take care.